What are some of the negatives of a hair transplant in the future? I'm close to my 40s, single, and insecure with low self-esteem. I'm very close to scheduling my appointment, but worried about what will be the repercussions when I'm 50 to 60 years old.
Thank you for your question. You submitted a question without a photo, but you're basically asking a very good general question. You're asking and stating that you are in your 40s, you have issues with low self-esteem, and you are considering a hair transplant. But you're asking what are the negatives of that and how will this be relevant in your 50s to 60s? Well, I can certainly share with you how I counsel patients who come to my practice about this very same question. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and hair transplant has been a significant part of my practice, and more importantly, I am the founder of TrichoStem Hair Regeneration Centers. We developed this method of non-surgical restoration of hair for people, for both men and women with thinning hair, using regenerative technology that we used initially to improve the outcomes of hair transplants. So this question, first from a broad sense and then from a strategic sense, should be dealt with. So to begin with, you have to think to yourself, how advanced are you in terms of your hair loss? And what is an outcome that you want to see, and how long can that outcome last? So when people come in their 40s, it's a very different situation if they were to come when they were in their 20s or 30s. And that being said, I would say the single most important strategy is how it's not about the outcome of the procedure. It's actually about how to sustain results. For so many years of doing hair transplant, the greatest frustration we had with hair transplant was to do a great procedure and get a good result that was aesthetically an improvement. But then, year after year, the person continued to thin. With men, we would try to encourage the use of Propecia or finasteride to slow things down. Unfortunately, issues with side effects as well as just compliance and responsiveness. Only 60% of men respond to Propecia or finasteride. And so led people a few years later to need another transplant. And they kept on thinking that this permanent zone would be able to yield comparable amounts as the first transplant. Well, regardless of whether you're doing an FUT or a strip method or FUE, you are likely to probably get the best transplant out of your first one if you are at the level of a moderate hair loss patient, which is typical when people seek attention. People don't seek attention when they're first slightly thinning. They seek attention when their thinning has advanced to a point where they're really getting anxious. So we wanted to try to improve the outcomes of our transplants. We started with using something called Acellular matrix to maximize the healing of the grafts, because there's a certain loss of the grafts even with excellent surgical technique and all the other variables controlled for, as well as improve the healing of the donor area, because the scar was also an issue. What was discovered, incidentally, was that thinning hair started to look thicker in various patients. So what I did was I developed a process and a system to actually do the treatment without the transplant. In other words, if you have thinning hair, we have now developed a process called hair regeneration, which we're able to stop the progression of hair loss, reactivate hairs that are not growing, as well as induce the shed of thinning hairs for the growth of thicker hairs. And then when I started to look at the relative comparison of someone getting a transplant versus someone getting hair regeneration, it became very apparent to me that there was a big opportunity for someone who has existing thinning hair to do hair regeneration to significantly improve their hair loss and actually get coverage. And it often is the case, it actually exceeds the results of not one but 2 hair transplants. Now that seems a remarkable statement to make, but when you think about it, if hair thins, let's say in the crown outward, it tends to regrow from the fringe inward. And the volume of hair that covers that area far exceeds any transplant. That being said, it is my practice that when a person comes who is strongly considering hair transplant, that I advise them to first do something to stabilize their hair loss. Again, the donor area cannot continuously yield more hair. You will eventually run out. It is very common for us to see patients who come here who have had 3 to 4 transplants, and they've got such thin hair coverage from just transplants because they lost all of their native hair that it doesn't look good. Very often people will criticize the outcomes of hair transplants and say, well, I don't want to have a pluggy look. Well, the reality is they didn't have a pluggy look while they had hair. It's only after when they lost their existing hair that the, quote, hair plugs or grafts become more apparent. So I can't stress to you enough that some strategy, whether it's taking finasteride, whether it's a technology like hair regeneration, you're already thinking proactively. You're thinking about the future, what's going to be in your 50s and 60s. Well, again, degree of hair loss, rate of progression are 2 very important factors to factor in. But really, given that we have so much experience and we've been doing this for many years, patients come to us from all over the world for hair regeneration treatment, it has become remarkable for us to see how people who are ready for a transplant will come, have hair regeneration, and then ultimately decide that they don't need a transplant. And it makes a lot of sense when you just think about when someone chooses to have a consultation. They were thinning, and they were thinning for a while. But then one day they decided they've lost too much and they want some kind of help and intervention. So with hair regeneration, we take a lot of these patients and they improve to the point where they look the way they looked a few years ago. And at that point, they didn't feel like they needed attention. So in many ways, we have actually helped people avoid a hair transplant. Now, it doesn't mean that hair transplant is a bad thing. A hair transplant is a great operation, but it has limitations. And until recent history, hair transplant became the first procedure of choice because we didn't have other alternatives. Now we can actually incorporate hair regeneration as part of the strategy, and the reality is I think that so many men and women would never do a hair transplant, but they wouldn't mind coming in for a single injection treatment, which I didn't mention earlier, can last 5 years and longer. And that's from our own data and our own patients who we followed for this much time. And we do a lot of these injections a week for patients who come from all over the world. So it really is, this is an interesting time in the narrative of how hair loss can be managed. If you're already bald, then even then you have to think about how to limit, whether if it's frontal recession or diffuse thinning or just just significant advanced hair loss like a Norwood 6, you still want to stabilize whatever you can so that you can coast into your 50s and 60s and look as good as you can. So I hope that was helpful. I wish you the best of luck. Thank you for your question.